It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
And hello again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area. Of course, Candace, that help change people's lives.
They certainly do. We're going to kick it off with our first best doctor. It's plastic surgeon Dr. Robert Wilcox.
I had 2 children in the last 4 years, which is wonderful. I wanted to, get back to my normal shape, and I, started looking into getting lipo and things like that, and so I found Dr. Wilcox.
Well, liposuction is still one of the most popular cosmetic procedures done nationwide, as well as in our own practice. My preferred technique is ultrasonic liposuction, and that has proven the test of time. It's been present for about almost 15 years. Rather than just literally ripping the fat out, the cannula or wand is made of titanium. It's about this length. It has a hollow bore down the middle for suction. The tip of it vibrates over 20,000 times a second, and that's how it gets its name, ultrasound. And so we can just go back and forth gently until we can get about 2/3 of the thickness of the fat removed.
So I came in, told Dr. Wilcox that I would like to slim down around the hips, look at some areas of the stomach where the fat wasn't coming off. So he explained to me, he showed me what all he could do and what the result would look like. I was pleased with what his expectations were.
First of all, during the consultation, I make clear to them the best thing about coming to our practice is they're going to get the straight story. There are many patients every week who come in where I explain, I don't think the surgery's for you. We may be able to offer a non-operative measure, or maybe they just need the encouragement to realize they don't have the problem that they perceive in the mirror. In Victoria's case, she came in requesting the breast enhancement and liposuction, so we looked at her and looked at the common areas that are usually done. And she has a nice figure, and she was close to her ideal weight, but she had enough fat on her hips and abdomen that we could help her with that and make a significant difference.
I'm extremely happy with the results. They've exceeded my expectations as well as my husband's expectations. It is a quick recovery for such a big result that you get. It's just very exhilarating because I just have me back.
I had been living with neck pain for about 15 years. It took a few of those years to figure out that it was really my neck. It was horrible, lots of neck pain, terrible headaches, nerve pain down my arm. My middle fingers in both hands would go totally numb. Makes it very difficult to work when your fingers are numb if you're working on computers. I had had a bulging disc in my neck. It started out to be just one bulging disc, but by the time we found Dr. Rimlawi and got in to see him, I actually had 3 bulging discs.
We looked at her neck, and I said, unfortunately, it was a big portion of her neck. It wasn't just one level. A lot of times people come in, they have 1 or 2 levels. And poor Tara, she had about 75% of her neck that was involved, that had some type of problem in it. She kind of felt that she wasn't fixable. She wasn't able to do the activities that she normally liked.
I couldn't do important things anymore, like my husband and I couldn't go dancing. I couldn't go on walks with my son. We couldn't go play at the park, to the point of not even being able to lift a gallon of milk out of the fridge. The quality of life had diminished greatly, and it was very depressing.
This type of surgery she had, normally it would have a big incision really from here all the way down. A lot of muscle cutting, a lot of bleeding. So there's a little trick where you can go in between this muscle and this muscle, right between them right here, and you can get away with really not cutting or hardly cutting any muscle at all. Cosmetically, it's better for the patient. Pain-wise, it's better for the patient. Recovery-wise, it's better for the patient.
The relief that I've gotten from Dr. Rimlawi and the minimally invasive procedures is such a godsend. It has been such a blessing in my life and has given me the quality of life back.
She's like a whole different person now. That's the best part about this. You see a patient, it's amazing how much neck pain or back pain can change their life and make them into somebody they're not. And then now I see her and she's so happy. That for me is the ultimate gift.
How do you know the difference between having a bad cold and having allergies? It's important to know because sometimes that depends on whether you go to the doctor or not, or whether you stay home or not from work or school. Well, a bad cold is caused by a virus. So you generally have fever, you generally feel bad, you feel achy. The reason you feel achy is the viruses live in the tiny capillaries in your muscles. So in those capillaries, they swell up because the virus is there, and then you hurt. Also, you generally get chills and have generally been exposed to someone who's had similar symptoms. Allergies, you generally tend to sneeze, you don't have achiness, you don't have fever, you don't have chills, you may have itchy eyes and runny nose. Also, when you have a bad cold, your mucus, the stuff that comes out of your nose or your lungs, might be discolored, thick, yellow-green, whereas it's going to be thin, clear, and watery when you have allergies. Now, there's different ways to treat these things, especially if there's a bacteria involved. You might need antibiotics. So basically, just remember, it's fever, chills, and just feeling horrible all over. That usually means a bad cold with a virus or a bacteria, and you need to see your doctor. Otherwise, it's probably just allergies. Just get some stuff over the counter.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education, and the Medical Minute tab.
Well, psoriasis is a fairly common disease. We see a lot of that in our practices, and probably a good way to think of it is normally it takes your skin about 6 weeks to grow from the very bottom layer all the way to the top layer. In psoriasis, that's accelerated up to about 2 days. So your skin is just growing much more rapidly than it should, and it's causing a lot of scale to develop, and it's associated with redness and a rash that you see. But it's mainly just the skin is really growing far too rapidly. Psoriasis can affect people at any age, but it tends to be more common in adults. Most people we see that develop psoriasis are probably in their 20s, teens, sometimes a little bit older. And it just kind of comes out of the middle of nowhere. Sometimes people can be under stress and can develop. Sometimes people can get an infection, like sore throat, and they'll get what's called guttate psoriasis. You get a widespread eruption of lesions that develop, and usually that kind of goes away after a relatively short period of time. Most cases of psoriasis do tend to run in families. There tends to be a genetic relationship to it. So someone in your family tree probably had psoriasis somewhere along the way if you get it. Just like atopic dermatitis can be worsened by bacterial infections like staph and strep and things of that nature, psoriasis can too in some cases. And for that reason, in addition to using some of the things like the creams that we use to kind of slow down the growth of the skin, sometimes we use things targeted to try to get rid of underlying bacterial infections. So we'll even recommend bleach-containing washes in some cases, even for psoriasis patients, even though we don't think that's actually directly affecting the psoriasis. If they've got a bacterial infection that's making it worse, you get that better, the psoriasis will get better too sometimes. You do have it for your whole life, but the good news is there are treatments that can put it into remission, and some people go into long-term remission. They may have psoriasis that's really bad for a number of years. With good treatment, it may just go away, and then you can taper the treatment off, and it doesn't seem to come back for long, long periods of time. So it sort of behaves in different ways in different people, and we never really know for sure what it's going to do until we actually treat the person and get them into remission.
Bryan's House serves families who have children with special health needs. So it's children with cerebral palsy, with autism, with Down syndrome, with a variety of developmental and medical needs. the families can't work, can't do a lot of what they need to do because they have to take care of the special needs child. Bryan's House provides a range of services: child care, early childhood education, after-school programming, parent education, social services for those families.
I'm a developmental pediatrician, so my specialty is taking care of kids with special health needs and developmental issues. So just listening to the families, I know firsthand how important these type of services are to the families. Bryan's House also accepts siblings into care, so the parents are only coming to one preschool for their children. So it just really serves a very important and unique need. No other place in Dallas does what Bryan's House does.
Many of our families are low income and they really struggle to keep their jobs and to be able to earn a living for their family. They love their children, are doing everything they can for their families, but without support from the community, they really can't provide child care and other services for their families. And by supporting Bryan's House, you support those families.
Our care is very specialized and very unique. It's also very expensive. It's all individualized care. We have nurses on site. It's very important that we get fundraising because we don't belong to any special group like one cause or another. So we kind of accept everybody with developmental medical issues. So we really don't have one funding source to go to. So we're looking to the community for support, and we're trying to do it in ways through the golf tournament, through our gala, to heighten the awareness of Bryan's House and heighten the need. But we really appreciate all the community support that we've gotten so far. We wouldn't have been here for 25 years without it.
In celebrating the 25th anniversary of Bryan's House, they will hold a gala fundraising event at the Azouz Hotel on November 1st.
On November 1st, we're going to celebrate our 25th anniversary with a gala at the historic Azouz Hotel, featuring Texas singer-songwriter Sarah Hickman, who's going to entertain us. We're also going to have a silent auction followed by dinner and then a live auction, and then Sarah Hickman is going to rock us out for the rest of the evening. Funds from the evening will go to support our early childhood education program, as well as some of our social services that help with parenting education, financial education. We also have summer programs and respite care services. So Bryan's House really cares for the whole family. When we accept a child, we accept the whole family. You can either call Bryan's House at 214-559-3946 or go to our website, which is www.bryanshouse.org, and that's Bryan with a Y, and click on the Donate Now button.
Check out the Best Docs Network website to view lots of videos on all of our amazing doctors, and you can even request an appointment. It's bestdocsnetwork.com.
All right, Candace, let's move on to our next doctor. One of the best plastic surgeons in the entire Dallas-Fort Worth area. It's Dr. David Azouz.
I had my gastric bypass in May of 2011, and after 2 years, I lost 100 pounds. After losing 100 pounds, I had a lot of excess skin on my belly. I've always been big around my belly area, so that's where I carried all my weight. I felt very unhealthy with it and wanted it removed.
The problem is when you lose that much weight, your body and your skin cannot go back to where you would like it to go back without help. And there's no way with exercise that you can get rid of the extra skin that's hanging, that has been stretched out, often has a lot of stretch marks. And in some patients, you do need to do a brachioplasty or remove skin from the arms. In some also you need to do a breast lift. In some you have to do a facelift to correct the extra skin around the face. So everyone's a little bit different. In Karen's case, her major problem was her abdomen, where she had all this extra skin and this pannus that she wanted removed, that she could not get rid of, despite the fact that she ate well and despite the fact that she was working out regularly.
When I came to see Dr. Azouz, I weighed 151, and that was because I was still carrying all the fat that was around my belly. He had explained to me the different procedures that he has. He explained to me the tummy tuck in particular. It was what I was interested in. When he examined me, he found a hernia, which he repaired while he did my tummy tuck. Dr. Azouz cut off 8 pounds of fat from my belly.
And of course, her skin was very poor quality. It was all had been stretched out from when she was a size 24 or 26.
Once I had my tummy tuck done, I dropped like 4 sizes right away. Dr. Azouz told me when I had the tummy tuck, I would lose another 20 pounds plus what he cut off. And I did. I started at 248 before my weight loss, and after my tummy tuck, I'm now at 124, size 0.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Mohs surgery is a surgical technique for the removal of skin cancer that enables us to examine all of the surgical margins of the tissue that we're removed so that we're sure that we've gotten all of the skin cancer.
The first time I had any problem was out in California. And I had some work done in here. But the doctor told me, he says it might come back because they didn't have the Mohs system at that time. Then I had this one.
Mr. Wattier presented with a recurrent squamous cell carcinoma involving the right posterior auricular area. The posterior auricular area is the area behind the ear and extends onto the anterior portion of the scalp and the upper portion of the neck. It also involved the posterior aspect of the right earlobe. During Mohs surgery, we were able to get a clear margin. I believe it took 3 stages of Mohs surgery before we had clear margins. The resulting wound was approximately 3.5 centimeters long by 2.5 centimeters wide. What we did was come up with an advancement flap that required removal of Burroughs triangles, small little triangles of tissue at the superior and inferior edge of the wound. We then undermined the tissue, advanced it to the edge of the posterior auricular sulcus, sutured that in place, and then used one of the Burroughs triangles that were excised as a skin graft for the defect on the posterior aspect of the right earlobe.
So you had to do a little patch in there. See, the ears aren't the same. I lost part of my ear here. It's healing up a lot better than I thought.
He's now 4 months post-op. All of the sutured areas have healed very nicely. The skin graft took very nicely, and everything looks perfect.
These make you feel relaxed all the time. It really is nice.
We are here with the go-to guy as far as when it comes to bariatric surgery, Dr. Adam Smith. Welcome to In the Studio, the Best Docs Network In the Studio. And Dr. Smith, right off the top, tell us what makes your practice so different from others?
I think the one thing that sets us apart, or at least we feel makes us unique, is the fact that I've been through the same experience that our patients are going through. I've made those decisions, I've had the same struggles, I've had the surgery, gotten through the surgery, and been fairly successful after the surgery, and that's how we created our practice, to ensure that our patients get that experience from start to finish.
And with you doing that, you know how important it is to have the so-called personal touch with the patient.
Yeah, I think that the surgery is just kind of a turning point in a process that's really a lifelong lifestyle change. And the surgery is important, and it's an important tool that we use, but that's really just the beginning of a journey. And so we keep in touch, lifelong, long-term with the patients to keep them successful long-term.
That's great. Now, Dr. Smith, tell us, who is the perfect candidate for this type of surgery?
Well, I haven't met the perfect candidate yet, but we certainly like to see someone that has struggled, that has been overweight a significant amount of time, but have had some success. They've had some success on a short-term basis with diet or modifications of their behavior, but their genetics are such that they just can't keep the weight off. Those are the people where surgery can really help. It's not just a quick fix. It's someone that has really tried, struggled, and still needs just a little extra help to succeed.
Okay, you say that, and you're talking about a lot of overweight people that just cannot get those extra pounds off. Tell us now, what type of surgery is best?
Well, there is no perfect surgery. There is no perfect surgeon, although a lot of us may think we are from time to time. But the surgery is just a tool that our patients use to help them have a level playing field. If they've been overweight over 5 years, the deck is stacked against them. And whether they are the best dieter in the planet or the best exerciser on the planet, without a level playing field, which surgery gives them, none of them have the ability to have long-term success.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com. For more information about any of our outstanding doctors you see on today's show, even request an appointment, head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com. Right now, it's time to head to our next best doctor. It's pain management specialist, Dr. Jason Williams.
When patients come to see me, they're usually at a point where the pain is starting to affect their daily life, whether it be at work, their personal life, their moods, anything of that nature. They notice that the normal things that they used to do aren't really helping anymore, such as taking medicines that they get over the counter or going to see a massage therapist, chiropractor, acupuncture. All those things seem to be failing, even if they have worked in the past. So at that point, the patients are at a point where they feel that there's something else going on and they need to be evaluated to figure out what is wrong with their low back or neck. When a patient comes in my clinic, first what I like to do is sit down with the patient and learn about what's been going on with them. That's, do an extensive history, spend the time with the patient to find out why they're hurting, where they're hurting, how long they've been hurting, and that's in addition to a physical exam to see if I can't evaluate the nature of the pain that the patient's having. When patients come to my clinic, this is a perfect example of what a patient might be experiencing that could be causing their low back pain or leg pain, or even their neck pain and arm pain. This is a herniated disc, or an example of a herniated disc where the nucleus pulposus, or the center of the disc material, has actually excreted through this annulus fibrosis. When this happens, this can cause spinal stenosis. It can actually impinge upon nerves in the spinal canal itself, or if you can imagine a nerve root coming across this, coming out, exiting to your leg or your arm, and it actually getting pinched off by this herniated or bulging disc. What the Acuroscope procedure does is it addresses a condition like this. The laser energy is focused right here on the actual bulging or herniated disc, where it can reduce the herniation and improve circulation to the nerve and reduce impingement on the nerve, and patients can have immediate improvement of their symptoms and pain.
I never had an experience as I had with any of the other MRIs I've had over my lifetime. I came here and I thought I was back at my own house, and the people were so welcoming and caring. What did I need that was extra? Was I comfortable? And I was never left alone.
Everybody at Preferred Imaging was really great.
that kind of attention. Over here, they were very concerned with my state after the MRI was finished, so they have chocolate cookies, they have candy, they have whatever you want, water, or so forth and so on. Sit down and wait and rest. This is unusual for me as a patient. I'm really happy that the doctor and the radiologist found some specifics that made my procedures less than they would have been and much easier for everybody. So I'm very appreciative of Preferred Imaging and its staff.
Having that peace of mind was very important because once I found out that I was going to stay off for just some time and I realized it wasn't like a rupture or something like really severe, that really like kind of eased the burden within me, and then I kind of can project and have a game plan as far as when I want to get back out there and start working out again and running. Gave me a lot of peace of mind.
I came to Dr. Lewis because I always wanted to have really white teeth, and my teeth were straight. I never had to wear braces, didn't have any of those issues, but I had extreme sensitivity. So I could not use any of the whitening strips or just the gels that anyone could. My gums were receding probably because I am one of those brushers that brush the wrong way, didn't do the circular motion.
She really wanted veneers. She had just gone through a lot of personal stuff and she wanted to make a change in her life, but she really did not want her teeth touched. She did not want anything reduced on her teeth or anything prepared.
So he sort of walked me through the process, and I found out that what he could do was I didn't have to have any, didn't have to have my teeth all filed down. They just sort of buffed them, and he just recreated sort of my smile. It's really strange because it didn't change a whole lot, but it did change a whole lot.
So we did the set on her and they turned out beautiful. I've done thousands of them and people are very happy with them. And what we found out is, in most cases, they're stronger, even though they're very thin, they're stronger than regular veneers because the strength isn't derived totally from the thickness of porcelain. I mean, you have to have a certain thickness, but it's derived from the bond to the tooth. And we found that when we bond to the enamel, which is the natural outer layer of the tooth, that we get a much stronger, much harder veneer.
Just the craftsmanship was amazing. I mean, it was like going to a Da Vinci or somebody because it was such tiny details, but it really changed my smile.
So in actuality, not only are they, less destructive to the tooth, or you don't have to take anything off the tooth, but they're also stronger, and so they look great.
It was painless. Came back, put them on, was getting my hands massaged during the whole process, and I walked out and I had a perfect smile that looked natural. I enjoy smiling, and I love having people say, "Oh, you have the prettiest smile."
Well, thanks for tuning in to another edition of the Best Docs Network, featuring some of the best doctors in all of the Dallas and Fort Worth area that are helping to change people's lives.
And if you want more information about any of these outstanding doctors, as well as request an appointment from any of the doctors, head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com.
And if you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.